So I'm gathering from that any yoga teacher who's teaching in a public space would likely benefit from learning more about trauma-informed yoga principles, just teaching to the general population, teaching in public classes. There are a lot of these core principles that they could bring into their teaching that will make their classes more accessible and expanding someone's potential capacity for presence. And especially, this is indicated for people who might want to be teaching in certain populations that have experienced systemic oppression or, um, yeah, are just generally more exposed to traumatic experiences.
Absolutely. And not to mention, like, maybe there's therapists or clinicians or social workers that want to bring more body-based principles or body-based approaches to their work, their scope of practice. Like,
Mhm.
trauma-informed yoga could be something that they study to bring in some breathing techniques or to bring in some meditation techniques in a trauma-informed way, because as we mentioned, those are all yoga
Mm,
too,
mm,
into their clinical scope. So I think, it can go beyond just yoga teachers. It could be, directors of nonprofits or social workers, therapists, clinicians, even body workers that might want to bring some of these principles or
mhm.
approaches into their work. So I think it can go beyond just the yoga space too.
Wow, that's a great point. Yeah, so many different types of therapists, whether you're a massage therapist or what have you, that are holding space for people who are likely coming in with difficult experiences. And yeah, that this could be applied much further beyond yoga. It seems like this is what you're talking about is also just trauma-informed principles for holding space in general.
Mhm, mhm, mhm. Yeah, especially if we're bringing in like meditation or breath work or any sort of movement. Absolutely. Like, yeah, the trauma informed principles can be applied.
You're reminding me of when I was in my therapy training, and it's so common nowadays to bring mindfulness practices into therapy, and I remember a lot of my colleagues had no background in yoga or teaching meditation, and that was just very difficult to find. It's difficult to find the words. I mean, we've been doing
Mhm,
teacher trainings for a while. It's difficult to know what to say, and then also to incorporate these aspects of being trauma informed in a therapeutic space is
mhm.
really not easy.